Greetings everyone. Jambo. Welcome to Marafiki Wellness Club, where exploring collective wellness is our way. We believe that personal commitment is the catalyst of lasting change. My name is Lillian Njoki, or Rafiki Lillian. I'm many things. I'm a mom, wife, hospitalist, community organizer, but most of all, I see myself as an explorer when it comes to wellness. Rafiki means friend, Marafiki means friends. Here at Marafiki Wellness Club, this is a space rooted in the collective power of community, and its pillars are 5, which is restorative rest, nutritious foods, exercise, healthy relationships, and community contribution. Through expert insights, wellness events, and community-driven support, we are here to make well-being accessible, sustainable, and shared. Welcome to Marafiki Wellness Club podcast. My name is Rafiki Lillian, or Dr. Njoki. Our title today is Immunologic, where we will decode your immune system through analogies, stories, and science. In today's episode, we will explore the basics and brilliance of both the innate and adaptive immune system, unpack food reactions, and demystify allergy testing, plus you will enjoy trivia games and functional medicine insights. Today, I am joined by my 2 friends. They are not guests anymore. These are 2 people that I really love going through life with and also learning together. So we are learning how to actually teach these topics to people. Last segment that we just did, I got some few feedbacks. People were saying, hey, it was really nice. We just need more analogies. So this time we are going to really try to give more analogies about immune system part 2. I am joined by my 2 friends. Please introduce yourself, Monica.
Hi, Dr. Monica Halka, but that's not a medical degree. I'm a physicist by training, but I think I'm mostly here because I'm so interested in this topic. I've been interested in health and wellness for a long time, and actually pretty experienced with teaching mindfulness and the meditation associated with it.
Mm-hmm. And?
So I'm a Vedmia Fonkem, a family medicine trained hospitalist. And I'm here because I love the learning process and I'm a glutton for punishment.
Yes, good. Thank you so much. So, last time, we covered a lot on the innate immune system, and this time we are going to cover on adaptive immune system and some few things. But I just want to know how have you guys been since the last time we talked? Have you done anything exciting?
I turned 72 years old.
Monica, happy birthday! It didn't pop up in my calendar. Oh, man.
It was yesterday. Yes.
Oh, yes. I have to do something about that. Wow. You look incredible.
Thank you.
Incredible. Yeah. What about you, Fonkem?
You mean besides working?
Yeah, besides working. We want to separate work for now.
Slowly incorporating meditation in my life.
Good.
Yeah, good.
Very slowly, but we're getting somewhere.
Yes.
Still a lot of drifting out.
Yeah.
Okay.
Wandering mind, still very big on that.
Yeah. Good.
Progress.
Now, for me, I had a chance to attend the functional medicine conference, annual conference in San Diego for 4 days. And it was so incredible being amongst practitioners who really want to help people, who are not just, they're not satisfied with the way the medical system is. They really want to help people find the root causes of their illness. And it all comes back to, the 5 pillars of Marafiki Wellness Club, which is, stress reduction, exercise, nutrition, healthy relationships, building communities, But changing people's behavior, it is something, It's difficult, and I think it can be well done within a community. So that was my, like something exciting that I am glad that I got to do this time.
Wonderful.
Yeah. So I have a lot of information that I got from that conference, and slowly we will be sharing that with the community. But today, let's get into the meat of why we are here, okay? So, Dr. Fonkem, I'm going to start with you. You're going to give us just a brief summary of what innate immune system is, and I'm going to give some analogies. Monica, I would like you to stop us in between, for brief periods of just meditating and helping us, kind of like, hunk down on the materials that we have learned, because as you know, this is dense materials, right?
It's dense, and I will have questions too.
Yeah. Okay, so Dr. Fonkem, please give us go ahead.
The innate immune system is more of what they call the primitive immune system, not specialized, very broad and general. It's very quick to respond. So you talk about like barriers, natural barriers, and gut linings, where when you have any kind of foreign intruder, it just tries to stop it right there and then. Again, it doesn't have any recollection of if it has seen this before or not. It just goes to work by recognizing a foreign material and working on stopping it.
Okay, good. And as you remember last time I said, yes, it's very general. But now they're discovering, some epithelial layers actually do have memory. It's probably it's not well distributed information, and they're still researching on the intelligence of the innate immune system. So they're still doing that. But I'm gonna give you an example. So the innate immune system is like castle guards. Okay, they're quick to respond, but not very specific. And they include the skin, the mucous membranes, the neutrophils, the macrophages, natural killer cells, mast cells. And they fight invaders immediately, but they don't really remember them. And for example, the macrophages, they're like sanitation workers, and natural killer cells are like secret agents. So that is just like a brief summary of what the innate immune system is. Now, I got a quick question. Which cell is most associated with pus formation?
Is it the mast cell?
No, not the mast cell. It's the neutrophils.
Neutrophils.
Yeah, the neutrophils. Yeah, that was just a small question. I wanted to put it out there. Okay, good. Now we're going to go to the session adaptive immunity. And I'm going to state the core features of adaptive immunity. One, specificity. Okay. It responds to unique antigens, like fingerprints on each pathogen. So each pathogen has kind of like a fingerprint, right? So that's how specific it is. Number two, memory. It retains a record of every battle won, and it's going to be ready for the next time. Okay. Three, diversity. It can recognize millions of different antigens. Number four, self-tolerance. It learns to ignore the body's own tissues and recognizes the pathogens. These are the core features of adaptive immunity: specificity, memory, diversity, and self-tolerance. Okay. Now, adaptive immune system has two branches. Okay. The first one is called humoral immunity, which is B-cell driven. Then the second one is cell-mediated immunity, which is T-cell driven. Okay. Dr. Fonkem, do you want us to give us more on the humoral immunity?
Yes. Excuse me. So the humoral immunity, again, this is mostly, like you said, the B cell driven. Now, B cells, again, these are like cells that when they get in contact with an antigen, they multiply, right? Mm-hmm. And they become plasma cells. And these plasma cells now are what produces those antibodies, all right, which sometimes they're also called as immunoglobulins. And you see on the right IG over there. And these antibodies, if you notice, they are very specific, right, to a specific antigen. And that's where that specificity come into play. And every time that antigen triggers the system, it remembers and makes those specific antibodies. Something which goes on a lot is when you see with respect to, say, the vaccination, right? Like the flu shot that you get every time. That's it's a dead virus, right? It's not an active virus that they take, and they expose your system to it, and you really see the beauty of the immune system at work there, where it goes and it detects that antigen, all right? It's the virus, but it's not a live virus. So it detects it, all right? That's the dendritic cells. And then what does is it takes it and shows it to the B cells, right? And those B cells now gets activated and they multiply themselves, becoming the plasma cells, which now makes these antibodies. When you now get exposed to the real deal, which is the active virus, well, your body already has those antibodies, right? And it responds to them. It goes and it tags them and it inactivates that viruses. And that's how you get protected from this. So in a nutshell, that's how that system works.
Okay. Monica, do you have an analogy for that?
I don't have a question for that. When I'm looking at this, I see B cells and the T cells. So it seems like with the B cells make the antibodies, and it says they neutralize the invaders and tag them for destruction. And then is it the T cells do the destruction? The T cells destroy?
So, yes, and we are going to get more into that. Yeah, we're going to get to more of that because right now we are talking about the two main branches. And Dr. Fonkem just explained what humoral immunity is, which is the B cells. So the analogy I'll give is, so the B cells are like archers, like the bow and arrow, the archers, right? They have custom-made arrows, which are the antibodies. So think about archers who have like custom-made arrows for every antigen that they see. Okay, so let's say they see a COVID virus, they have a specific specific arrow that they have for it, and they shoot it. So they have already tagged it, right? So, and this is what is going to help the body remember, because of these antibodies. Okay. So that is what happens. So once trained, they build armories of precise ammunition to defeat the same enemy if it returns. So that is like an analogy that I can give. Is that clear?
Well, it's almost like you're saying they have like a different color arrow for each antigen, right? So
exactly.
Every arrow is different, is what you're saying.
Yes.
Okay.
Yeah. So that is the most simple thing that I can I can give. That's the most simple example I can give. Yeah. Okay. Let's go to the cell-mediated immunity, which is still cell-driven. So we do have two types of T cells. We have the helper T cells, and we have the cytotoxic T cells. So the helper T cells are also called CD4. So these ones, they coordinate the entire immune army, and they activate B cells and other T cells. And then the cytotoxic T cells, also called CD8, they seek and destroy infected or cancerous cells. So you're right. So the humoral B cells kind of like tag, and then the T cells come and destroy.
Okay.
Yeah.
Are those also called killer cells?
So no, those are the natural killer cells are actually in the innate immune system.
Innate, okay.
Yeah.
So these are just called CD8.
Yeah.
Okay.
And a good analogy that I can give is that the helper T cells are like the generals in a war room. So if you're in a war room, you do have the generals, right? So the helper T cells are like the generals in a war room giving orders. They give orders. And then the cytotoxic T cells, or the CD8, they are like elite assassins, and they only strike infected or abnormal cells. Does that make sense?
Yeah.
Yeah, we're going to give a lot of war. I've never been into war, but
It is war.
yeah, the body is amazing, like the things that it's doing for you, right? So it's, your body wants you to live, it wants you to live. So it's going to do all these things, for you to live. So you do have, this immune system always fighting for you. I want to go a little bit on the antigen presentation that you mentioned. And you mentioned that, natural innate cells, like dendrite cells, right? Remember when I told you when we were discussing about the innate immune system last time? And this is where the innate immune system come together with the adaptive immune system. It all starts when these cells they present the particles of the antigens. So they're called antigen presenting cells, like the dendrites. They capture pathogens. They kind of like go and get a small bite of it, and then they present them to the naive T cells in the lymph nodes. Okay. And as Dr. Fonkem says, and when they do that, they spark a clonal expansions of the T cells and the B cells. Okay, and when they do this, they create armies specific for this pathogen. So that's how the immune system work. Did you understand that?
Yes.
Is it very clear? Okay. Do you have any analogy for this, Dr. Fonkem, or on the antigen presenting cells? Do you have any analogy? I have a good one here.
All right, shoot.
Do you have one?
No, I said shoot yours.
I really worked hard on my analogies. Okay. Imagine a bounty has been posted in the city. A bounty, right? Mm-hmm. And this is what is antigen presentation. And both T and B cells begin recruiting soldiers specializing in hunting this exact target. So that is what happens, The antigen presenting antigen cells, they put out a bounty, for these antigens. Like, the viruses, the bacteria. And then both the T and B cells, they kind of like recruit, and they're kind of like hunting for these antigens.
Yeah, that's like when the FBI Most Wanted, right?
Yes.
They put the picture of the FBI Most Wanted, and everyone is looking for that one face, right?
Exactly. Okay. Now, the good thing is they don't have to do this all the time, especially if they kind of like know you. Now they do have a memory of you, right? So, and that is a good thing about the adaptive immune system, they do have memory cells. So after a successful immune response, so some of the B cells and the T cells are going to become memory cells. Okay, so they don't have to. The body is very sufficient. It doesn't want to keep on exerting the same energy. It already has memory. It already has memory cells for this. So these memory cells stick around for years, even decades, ready to respond faster and stronger if the same pathogen shows up again. Okay. So that is memory cells, or the hall of records. Okay. I have another good analogy for this. Do you guys have an analogy for this? You did not work on your analogies. I worked on mine.
No, I said good. We want to hear them.
So the analogies
They really help.
is like the war veterans. The way war veterans are always telling you what happened in Korean War, Vietnam War, right? That is the memory cells for you. So you need to think about them as war veterans who still carry the gear and can jump into battle at a moment's notice. Like let's say a soldier who fought in Afghanistan, right? Fought in Afghanistan, then came back to America. If there was another one, they had to go back. It would be much more familiar to them because they have already been there before. So that's what.
in this situation, though, when you say that they have memory cells, for example, the COVID virus, right? They remember for a while, right? But the invaders are always changing, right? Like it would be like the flu or like that. So it seems like the memory is really only needed in my experience, like with the flu and with COVID and the virus is always changing. Like the memory only needs to work for maybe a year or so.
And probably mostly for viruses, because viruses are always kind of like tweaking. They're very smart. I think viruses are very, very, very smart. They're always tweaking their membrane proteins. Bacteria's not so much, because, unless you become immune, some people have become resistant, to some of the bacteria. But viruses, because they're always tweaking their membrane proteins, yes, that's why you see like the CDC are always tweaking their vaccine, to keep up.
Cancer cells also, do they change over time like viruses, or do they stay pretty much recognizable to your
some
system?
some cancer cells also do tweak also.
Yeah. Okay.
I really don't know much about cancer, I should state that, but yes, some of these cancers do, because they're also very smart. They're trying to evade your immune system, Think about I'm more familiar with viruses. Think about the HIV virus, right? That's why you had like HIV virus 1, 2, they have like different viruses because they are very smart too. They want to live, they are alive, they want to live, so they have to change, Okay. And of course, you gave a good example about the vaccines, so that is good. Now we are going to go to, some games and trivia. Let's see if you guys remember. Before we go into that, what is immunodeficiency?
Again, just like the word said, your immune system is deficient for word to word. However, it's a state where your immune system is impaired pretty much by one way or the other. The most popular way that we know about that is, with the HIV that you mentioned, which is a virus that comes in and pretty much cripples that immune system, right? And so now, by virtue of that, your immune system is deficient.
Good.
And so it exposes you now to all the pathogens that can come in and evade the immune system even without trying.
Okay. And that's good. And that's,
you talk about that castle.
Yeah. And you're mentioning about HIV. You know what HIV does? It targets the helper T cells. What it does, it cripples the coordination, because, helper T cells, I told you, they are like generals, right? So it cripples the coordination of the immune system. So that is immunodeficiency. And what is autoimmunity? Autoimmunity, you're going to see it in autoimmune disease.
Yeah.
It's like when you have bad allergies and your body just overcompensates.
So when you think about autoimmune, right, it's like your body attacking your cells, So it's when tolerance fail. You remember one of the core function of adaptive immune system is tolerance, right? It kind of like differentiate between you and other antigens. So autoimmunity occurs when tolerance fails. So the T cells or B cells, they attack the body. So that's what autoimmunity is.
Do you have an example of that?
Let's pick lupus, right? Or let's pick even celiac, right? Celiac disease, right?
Oh, yeah.
Yeah. So your body recognizes, is triggered by gluten, right?
Yeah.
And what it does, it has these antibodies antibody combining, and then they're attacking the villi of your small intestines,
Right.
Yeah.
Okay.
Lupus, any autoimmune disease means that your body has lost tolerance. That's what it means. So you can be immunodeficient, or you can have autoimmune disease.
Is this the same if you have an allergic reaction?
So, and we're going to go to allergic reaction. Allergic reaction is different.
Okay.
Yeah, allergic reaction is different. Okay. So, let's do this. What makes antibodies?
B cells.
Yay!
I learned something.
Yes. What is known for coordinating the immune system?
Well, the generals, which are the helper T cells.
That's why she got A's in school.
Right.
It's you. Takes line sticks.
Yes. What cells kills infected cells? There's a coordination, and then there are assassins. Who are the assassins?
CD8? CD8?
Yes, CD8, and they are called what?
Cytotoxic.
Yes, good. Yeah. What ensures long-term immunity? Which cells? Which cells remember? What are they called? Simple. Memory T cells.
No.
Memory cells.
Yeah, memory T cells. Yes.
I don't know why I thought.
That was a trick question.
No, Monica, we're thinking so hard.
We're too scared.
Oh, good. Okay. Good. And that is our brief summary of adaptive immune system. So in summary, unlike the innate system, adaptive immunity is slow but smart. It tailors responses to each threat and builds memory. So B cells, they create antibodies. Remember the archers and with custom arrows, right? So those are the B cells. The helper T cells are the generals. They're giving instructions. The cytotoxic T cells are assassins, right? And the memory cells are the war veterans. Okay, good, perfect. Now, there is this conversation of local versus systemic inflammation. And local causing systemic inflammation. When I say local inflammation, what does it mean? And when I say systemic inflammation, what does it mean? What comes into mind?
Poison ivy.
Okay.
That's my local inflammation.
Okay. And you, when I say local versus systemic inflammation, what comes into mind?
Local inflammation, again, you just think about something which is pretty much localized, which is limited to one area, one body part, right? For instance, you have redness of your finger. It means that the area of your finger is inflamed. Now, when you talk about systemic, that's something which goes across the whole body itself, right? Something which is triggering a response that your body is responding to and causing all this constellation of symptoms where, we talk about just being overall tired, being having fevers, having, in medicine, Monica, a fun thing which we use, we call it SIRS, right? Systemic inflammatory response syndrome, where something has triggered that inflammation. With a local, there will always be something that's causing it. Like I said, with the example of a red finger, it's something that's triggering that local inflammation. Systemic inflammation, there's really not, for lack of a better word, a fire. Is just something that has just set the body into that overdrive.
Yeah. For instance, a simple example: somebody having urine tract infection, right? It's probably around that system, versus somebody having sepsis from a urine tract infection. Okay.
Sepsis, yeah.
So that means if you have a local inflammation, it's kind of like contained, right? But if you have systemic inflammation, that means some barriers have been breached, right? That's why you're having systemic inflammation, okay? So this is going to give us a good segue to two things that I've been hearing about. Have you come across the word gut permeability or brain inflammation? Have you come across the term leaky gut? or leaky
Oh,
brain.
yeah, leaky gut. Is that the same as irritable bowel?
That is an example. That is an example of irritable bowel can cause leaky gut, right?
Okay.
Yeah. So when you think about that, okay, leaky gut. So you remember we do have a lot of immune cells in our gut, right? So when they start saying leaky gut, that means leaky gut leaking to where, right? Probably the blood, the circulatory system around you. And then you're like thinking, but that is not supposed to happen, Of course, if things are leaking into where they're not supposed to be, just imagine what your immune system is doing, right? It's like, oh, danger, stranger, danger. These things are not supposed to be in the circulation. What are they doing? So just imagine what your brain is, what your body is doing, right? Then something else called brain inflammation or leaky brain.
I never heard of that.
Okay, so in our brain, right, there's a brain barrier, okay, and that blood-brain barrier, you don't want some things in your circulatory system in your blood going into your brain, right? So your body is very intelligent that it has that barrier. So there are some things that should remain in the circulatory system and never go to the brain, right? There are some things that are in the digestive system that need to remain in the digestive system without going into the circulatory system, okay?
What is the blood-brain barrier made of?
Oh, we have to go deeper into that. Yeah, but yeah.
Is it known?
I don't have all the verbatim proper here. Maybe we can do a quick Google search, but it is a barrier that kind of like it's very selective. It's very, very selective. It's like, okay, I'll give you an example, right? You have a coffee filter. You have a coffee filter that makes sure that all those granules from the coffee does not go through, right?
No, yeah.
And then when you have any leakiness, the coffee filter becomes like a sieve. So
Yeah, it's
things,
torn.
yeah. But I did send you a picture. Actually, we know what it is because I did send you like a picture of what we can start with the gut in the gut area, right? We do have they look like zips. They're called zonulin. They are proteins. They're kind of like they are part of the proteins that are in the gut barrier. Once that is breached, you see those pictures, yes. But I don't have the brain one, but I do have the one for the gut. Yeah. Okay. So did you have something to add, Dr.?
Oh, no, I was just going to say, again, these are barriers because they are supposed to let some stuff go through them. Mm-hmm. All right. So some things normally go through that gut barrier or the blood-brain barrier naturally, right? However, it becomes a problem when, again, it becomes leaky. It lets more than just the normal stuff that are supposed to go through it. Mm-hmm. And so when now it becomes leaky and all this abnormal stuff go through them, then it poses a problem to the system.
Yeah. Okay.
So, I have an analogy for you, U.S. Customs.
Ooh, okay.
Oh, okay.
I'm getting into the analogies now.
Yes, there you go. Yeah. So the gut lining, okay, it's not just for digesting, but it's also an immunological barrier, okay, between the outside world and our bloodstream. So a healthy gut lining has tightly regulated junction, okay. For example, one type of junction is called the zonulin, and this controls what gets absorbed into the bloodstream. So when these junctions are compromised, then that's where we get the leaky gut, okay. So can you give me examples of what can trigger gut permeability?
Well, we did say irritable bowel syndrome, right? Okay. That's one.
Right. So irritable bowel syndrome is what happens after.
Oh, okay,
right.
Okay.
Yes.
Okay. That's
yeah.
I'm sorry, what's your question?
Triggers for gut permeability.
Yeah, so big things will be like stress.
Okay.
Stress will trigger that.
Mm-hmm.
Wow.
Yeah, when you get stressed out, sometimes you can even get increased acid production in your belly, which causes inflammation
Oh,
there.
yeah. That's what people talk about ulcers from stress.
Yeah. Um, your diet as well, right? Uh, there are some foods that are high in oxidative stress, all right, and it can cause that uh, infection or well, bacteria, different types of bacteria. Because again, you have the bacteria that are normal in your gut area, and sometimes if you have very few of the good bacteria or a lot of the bad bacteria, it can release toxins that can affect that barrier as well.
Okay, those are good ones. Okay. You said chronic stress. So chronic stress raises your cortisol, right? And that degrades the mucosal lining. Cortisol is like steroids, right? So that
Yeah.
degrades your mucosal lining. Processed foods, things like emulsifiers, gluten, sugar, alcohol, also degrades the mucosal lining. Infections, parasites, H. pylori, this condition called SIBO, which is small intestine's bacterial overgrowth, whereby you have overgrowth of the bad bacteria compared to the good bacteria, that can cause that. Medications, medications, things like aspirin, Aleve, NSAIDs, those are not really good. And then, do you know what is the number one prescribed medication?
Ibuprofen.
Actually, it's a proton pumps inhibitor. People are always taking these medications like omeprazole, pantoprazole, right? That one can also affect your gut lining.
Yeah.
Antibiotics, that's why sometimes when somebody's on a long-term antibiotics, you want to give them things like probiotics to kind of help with gut dysbiosis. People who have food sensitivities, gluten, dairy, environmental toxins, glyphosates, heavy metals, water that is polluted, all this can be triggered to gut permeability.
Well, all this is making me very stressed. Should we do a short meditation?
Yes. This is actually good.
So there's a very nice meditation that's very short, and it's I've been thinking about it because I started taking painting classes recently and doing color mixing. There's a meditation where you clear your mind like we always do, and then you picture some different colors. And by doing that, you can find out which color makes you feel the most peaceful and relaxed. So we're just going to sit with our back straight like we did before, and we're going to clear our minds, do the mind clearing meditation for 30 seconds. And then I'll just ask you to picture some colors, some different colors, and you can just see which one makes you feel better. I really like this meditation. Okay. We're going to take 3 deep breaths in through the nose and out through the mouth with your eyes closed or almost closed. And we take our first breath, deep inhalation through the nose, and then when you exhale through the mouth, relax all your muscles. 2 more. Inhale, exhale, and relax all your muscles. Last one, deep inhale. And exhale and relax everything. Okay, then just go to your normal breathing and think about relaxing the top of your head. Just let everything slide off the top of your head. Just feel the release there. And move to your forehead and relax out all the wrinkle lines, the worry lines, and just soften. We think about relaxing your eyebrows. And then move to the area just outside your eyes, move to your temples. A lot of us hold a lot of tension there, so consciously think of softening the temple area. Now see if you can feel it when you think about relaxing your ears. Now your whole face and head should be pretty relaxed. Now we're going to relax the inside of your head. Just let any thoughts that are zipping around in there drift away. Just drift away or settle into the earth until you can just feel the space in your mind, the space to relax. Giving your mind space to just calm. Now let's picture a clear blue sky, the most beautiful blue sky you can remember. It's just everywhere, all around you. But you're seeing that beautiful blue color. Notice how it makes you feel. Now let that kind of soften into twilight, where the sky turns into a beautiful lavender just after the sun has gone down, a perfect lavender color. And then let that shift to deep purple. And now imagine the purple turning to a maroon, a burgundy, and into a bright red. Let the red soften and brighten into orange, like the beautiful fruit, that beautiful orange color. And let that soften into peach, like the beautiful Georgia peaches. Soft peach. Let that just slide into a light pink. And we'll take one deep breath in through the nose, out through the mouth. Let all the colors drift away. Open your eyes and focus on the first thing you see.
I see you. Dr. Fonkem, do you know your colors?
Peach is my favorite, but it can also help if you're really sleepy and you need to do some work to picture bright red. It can wake you up and give you energy.
Interesting.
Okay, good. Actually, this is a good segue because now we are going to talk about brain permeability and what it is. So, as we said, it's the same thing. You know, blood-brain barrier is like the gut barrier, but it's only more selective, right? Because you don't want anything going into your brain. You know, it protects your brain from toxins and inflammation. But sometimes chronic gut inflammation can cause, of course, systemic inflammation, and it can lead to the weakening of the brain blood barrier, leading to leaky brain. And some of the consequences of leaky brain is, what do you think the consequences of leaky brain will be?
Memory loss, maybe.
Yes, memory issues. What else?
Fatigue.
fatigue, brain fog, actually also neuroinflammation. Alzheimer's has many causes, and neuroinflammation is also linked to Alzheimer's.
Confusion.
Parkinson's, yes. Also behavioral changes, in children, some of these people, like ADHD, like symptoms, you really need to watch what your children are consuming, especially if you have like behavioral issues, yes. So the analogy that you use, airport security. So brain-blood barrier is more selective, it's like the airport security. They make sure that you're not going in with guns and things like that. They're more selective. Okay. And then you remember we do have a link between our gut and our brain, right? And the link between our gut and our brain is through the gut-brain axis. I think we have discussed this before. And it's normally bidirectional. Which nerve helps it? Which nerve helps the brain-gut communication?
Vagus nerve, sorry.
Vagus, yes. Yes.
Yeah, vagus nerve.
So there's bidirectional communication, there's communication between your gut and your brain and vice versa. So mainly through the vagus nerves, the immune system, microbial and metabolites. And what happens, the gut inflammation can also cause microglial activation. So microglial are in your brain. So they can cause microglial activation, causing brain inflammation. Also, gut dysbiosis, sometimes like when you're bloated and all of that, you feel, and then you're like, why am I feeling foggy? I mean, it should only be here. Why am I feeling that? It's because gut dysbiosis, they disrupt the neurotransmitters. You remember when I said 90% of your serotonin is produced by your gut, right?
Yeah.
So this is the link. It's the link between the gut and the brain. So gut dysbiosis here, they disrupt the neurotransmitters, So your gut and your brain, they're like twins that text each other all the time. They keep on texting each other, right? So if one is distressed, if your gut is distressed, it's like, oh, I'm distressed. So the twin is like, oh, I'm also distressed. They're like twins. They're always, communicating. So I just wanted to introduce these terms, because we hear them out there and people are like, is it real? Yes. This gut permeability, brain permeability is actually very, very real. Okay. And that's what I like about functional medicine, is because we look at everything holistically, right? So if you're having gut dysbiosis, we are still going to, that can also affect your brain. Okay. What is the root causes of this, functional medicine, they have like, they call them healing strategies. They call them, the protocol is called 5R. They help you figure out what's going on. So you have to remove the triggers. There's also the replacing. Let's say you a lot of people consume PPIs, the pantoprazoles, the acid reflux medication. So what happens? They cause your stomach to be less acidic. But naturally, your stomach pH is supposed to be 2, not 5. So that means you're not breaking down, proteins as you should, and some of these protein fragments are finding themselves in the circulation, So with functional medicine, they kind of like help you identify things like this. So they help you remove, they help you replace, they help you re-inoculate, things. When you introduce probiotics into your system, you're kind of like helping the microbiota in your gut. They help you with repair, and they also help you in the rebalancing. Okay, that is if you ever see a functional medicine doctor, they're going to focus on these 5 things. Okay, now let's go to trivia. We talked so much about that. Let's see if you guys remember. Okay, I have this lady. Her name is Alex. She experiences fatigue, bloating, and forgets where she put her keys after eating pizza. What could be happening to Alex?
Dairy.
She ate pizza though, yeah?
Yeah, the dairy.
Dairy has?
She ate the pizza and it had all kinds of bad things in it. She's suffering from bloating, so she could be having some leaking gut. Is that me?
Yeah. So,
Which affects her brain because of the vagal nerve.
what do you think, Dr. Fonkem?
Yeah, I think one of the consistencies is it happens when she eats pizza. So that certainly is very important. So now we got to figure out what's in pizza and how does that relate to her symptoms. I mean, when she eats pizza, she gets bloated, right? She also now notices memory issues. So, like you rightly said, Monica, is the pizza and all the unhealthy things, the oxidants in the pizza, does that lead to leaky gut, which now, as we just discussed, affects the gut-brain axis through that vagus nerve.
Okay, good. Wonderful. What protein regulates tight junction in the gut and also the brain-blood barrier?
You mentioned zonulin earlier.
Yes. Apparently, the zonulin are also found in the brain-blood barrier also. Good. What gut-derived bacteria molecule is a major cause of systemic inflammation?
Molecule.
Yeah, I think I did not mention this.
Yeah, it's lipopolysaccharide.
Oh, look at you, Dr. Fonkem.
right.
You know your stuff. Okay.
Just got lucky.
Are polysaccharides in sugar?
Lipopolysaccharides. Yeah, I mean, yeah, Go ahead,
Where
Dr.
do they
Fonkem.
come from? Sugar?
So lipopolysaccharide, I mean, I'll look at it as a. So this one which we're talking about, the lipopolysaccharide, it's part of bacterial structure, right? And that bacterial structure is a combination of fatty acids and also sugar molecules.
Okay.
Yeah. True or false? The brain makes most of its serotonin.
Wrong. False.
Good. That is false. Good. Wonderful. Okay. So we finished that segment. The root cause framework for functional medicine is actually identifying antecedents, right? Triggers and mediators, of diseases. Antecedents, these are things, that you're born with, genetics, your family history, those are antecedents. Triggers is what, that you face through life. It could be food, it could be your lifestyle, right? And also mediators are also, things that kind of like exacerbate, like illnesses. I'm gonna give you an example of an example here. Like if someone has eczema, right, and they have also they take dairy, and they have stress, right? So the dairy is the trigger, right? Because it can also worsen eczema.
Okay.
Stress is a mediator, right? It can make things worse, right?
Yeah. Okay.
Yeah. So we're gonna go to food allergy presentation, and what are the triggers, especially for immune activation and systemic illnesses. We're gonna focus on that, and what alters the intestine permeability, because I think this is where the most groundwork is. Your intestine permeability. Okay. And
yes.
we did discuss a lot of things. We said things like stress, infection, dysbiosis, inflammation, many diseases, impaired digestions, people having like low stomach acids by taking a lot of pantoprazole or omeprazoles, toxins, nutritional insufficiencies, and various medication. Okay. So this can lead to altered intestinal permeability. And when you think about that, if that barrier is altered, right, you're going to see a lot of like foods, proteins in the circulation that are not supposed to be there, right? And of course, your immune system is going to be acting crazy because it start forming antibodies. When you talked about it, this is something strange, right? dendrites, the neutrophils, they see these, they present these antigens to the T cells and the B cells, right? The B cells kind of
Yes.
like form immunoglobulins or antibodies against this. So that is where a lot of people have these allergies, stemming from intestine permeability. Also, you can have what we call malabsorption or malnutrition, especially if you're not like really absorbing foods, they're not being absorbed,
Yes.
all of this can lead to the immune activation and inflammation and also systemic diseases. Did you have something to add on to that?
No, I think you pretty much went over the star right there.
Yes.
But one thing which people do not really pay a lot of attention to is, stress. Like, again, because with function, I would talk about, stress and lifestyle changes and how much that can lead to this, which we really don't pay attention to. I mean, very few times patients come in and they have these symptoms, especially in the outpatient setting, and then you take it back to stress as being an etiology of this, seeing that if you take care of their stress, you can really help with a lot of the symptoms that they're dealing with, just like that.
Actually, Dr. Fonkem, when I attended the International Functional Medicine Conference, we were talking about stress versus chronic trauma. Because stress, of course, our bodies go through stress. Stress is normal, you have patients to see. Sometimes your body can be edged up so that you can be able to face whatever you need to face.
Right.
But if your body does not know how to debrief that, that can become a trauma, right?
Oh, yeah.
Yes, and chronic trauma. I think when they say stress, to me now I'm thinking probably it's chronic trauma, because when you think about this, when you face a stress, like when you see a lion, your body has to react in a certain way to face that, right? But after that, your body should relax. There's no lion anymore. But in some instances, some people are not able to debrief their bodies. Their body is not able to debrief. So something that happened to them probably a while ago, they're still reliving that. But they don't know, because they're like, oh, that happened a long time ago. But for some people, they have a way, the way they deal with stress is not they normally store it in their bodies, So I think, and that's something else that we can discuss. I have a lot of information to share with you, but that's something else that we can discuss, that it's not stress, it's probably chronic trauma, because I know some people, they eat well, they do everything well, but they're always having these things. I'm like, what's going on? Probably they need, it's not, I don't even think psychology, I don't know, I don't even think it's psychiatrists, because, sometimes psychiatrists is just medication. I think they need some other ways of dealing with chronic trauma.
Right, psychologists, CBT, therapists like that.
Yeah, and this doctor was talking about psychodynamic therapy. I don't know what that is, but I'm gonna have to study it. Psychodynamic therapy on dealing with chronic trauma. I'm gonna share with you her book, because she actually used to give medication, but now she does not. She actually focuses on those therapies to really help people. So that's something that we can delve into,
Of course.
Yeah, good. Okay. So let's talk about immune-mediated versus non-immune-mediated reactions. When I say immune-mediated, what comes into mind?
So, just from an analogy standpoint, immune mediated, again, I think of, saying you have something which is normally harmless in your body, right? But your body is recognizing that thing as if it's a threat, right? And for instance, if you find someone who has, let's say, peanut allergy, right? They take peanut, which is generally harmless, but now your body sees it and takes it as a threat, and now it does all of this pathway reaction that will be geared towards attacking that stress, that threat.
Yeah.
And so you go into what we call allergic reaction.
Yeah, and as we have been talking about, that involves the innate and the adaptive immune system, whereby it's going to involve antibodies, or T cells. It's going to involve the IgE. IgE is a type of antibody that is produced, IgG, etc.
Right.
But the non-immune, these are, maybe if you're lacking like an enzyme, like let's say lactose intolerance, and you're lacking the enzyme lactase, right? And it happens to a lot of us, African American Africans, because we stop drinking milk at a certain age. So later on, once we start consuming milk products, we don't have that enzyme to digest, So that is a non-immune reaction. You can also be sensitive to foods, some people are sensitive to MSGs,
Yes.
So that is the difference between immune mediated and non-immune mediated reactions. And I do have an analogy. Do you have one?
Yeah, so I guess the first part I said was actually the first part of my analogy, where you're taking something and your body is actually seeing it as a threat when it's really not a threat. So we talk about even with medications, right? You take penicillin and your body says, "Oh, that's a dangerous substance," so you become allergic to penicillin. Well, on the other hand, if you're talking about non-immune mediated, we're talking about taking that same penicillin, and for some odd reason, when you specifically take it, you get nauseous, right? And so your body is just because your body cannot process it right, right, in that standpoint, and so that's why you have that symptom.
Okay, good. So the immune-mediated reactions, they are like security alarm system, okay? So the security alarm system, it gets triggered and your body mounts a defense response, whether it's appropriate or not, right?
Yeah.
Like when we go through the classification of immune-mediated reactions, we have type 1 to type 4. We have type 1, type 2, type 3, type 4.
Yes.
Type 1 is IgE-mediated. And this involves the mast cells producing histamines. So the IgE mediated is like when you say somebody having like a peanut allergy. So they take peanut butter by mistake. I don't know how they take peanut butter by mistake, and then their mast cells sees this and it releases histamine. And you know what histamine does? It causes hives. Her blood pressure goes down. Sometimes some people cannot even breathe and things like that. That is immediate. It's rapid onset, and that is type 1. Okay. Type 2. Type 2 is also cytotoxic, whereby your antibody actually attacks your own cells. Okay, like hemolytic anemia. So your antibodies are actually attacking your blood cells in hemolytic anemia, and you're actually losing blood. Type 3 is the immune complex, whereby the antibody clings to the antigen and deposits it in tissues. And you see this in diseases like lupus or serum sickness. Okay, so that is type 3. And then type 4, Monica had mentioned that it's delayed and it's T-cell mediated. Like things like poison ivy. You get pricked by poison ivy, you really don't have a reaction now, but you have like a reaction later down the line. So that is type 4. Okay, so we have 4 types. Type 1, which is IgE mediated, which is rapid. You need your EpiPen for this. This is not the time to take chamomile tea. No, you need your you need your EpiPen ready. And then type 2, we said is cytotoxic. Actually, the antibody is attacking the cells. And then type 3, which is complex, immune complex, whereby the antigen and the antibody are kind of like clumped together and they deposit in tissues, like lupus. And then type 4 is delayed. It's a T cell mediated and it's delayed, Things like contact dermatitis, somebody has bought you a nice necklace, you're thinking it's gold, but it's made of it's made of nickel, and you start breaking out later on. That is a type 4.
Yes.
Okay. Okay. Now, when it comes to IgE, there is Ig mediated, we talked about in length, whereby you have swelling, hives, anaphylactic shock, and this is immediate. And then non-IgE mediated, like the type 4, which is delayed, But some people can have both. They can have both IgE and non-IgE, Like, actually, I had a patient today. She had eosinophilic esophagitis. Her presentation was, I have been choking. She had been choking on food, like for several times. And when she came in today with the food bolus. She was choking on some food, and they had to do like an EGD to remove the food bolus. And when they were doing that, the presentation in the lining of the esophagus was very similar to eosinophilic esophagitis. So when I saw this, I was like, that is a mixed IgE, non-IgE.
Wow,
Yeah.
that's interesting.
Yeah, that is the nerd in me. Sometimes I do that. Okay. Okay, so now let's go into depth a little bit about the non-immune mediated reaction. We talked a little bit about them. Do you want to summarize them? The non-immune mediated reactions.
We're a little bit forward.
And if you have a good analogy, let me know. I have a good one, but let me know if you have a better analogy.
With the non-immune side, we spoke about things like enzymes or other chemicals that you can be intolerant to. And again, this is just because for some reason, which again, there are many medical reasons why your body cannot really process something. So when you look at the case of, so here you have lactose intolerant here. I mean, why can't your body process lactose, which is normally supposed to process it? Well, because you don't have that enzyme lactase to process it. So every time you taking lactose, your body responds adversely to it, and so patients will now go and they either start taking lactate or they just avoid lactose products altogether, and that by itself is already very, very tough for the patient. It really affects their lifestyles badly, and that can lead to a chain reaction where now you have stress from that into chronic stress and just compounds the effects of what you're already dealing with.
Yeah, good. So my analogy is like non-immune mediated reaction is like plumbing issues, right? Rather than security alarm. We say the IG is like security alarm, right? These are like plumbing issues. Your body can't handle or break something down properly. But it doesn't involve the immune soldiers. However, this non-immune mediated reaction, if it's not well under control, eventually, it can cause, more issues like permeability. So we mentioned lactose intolerance. We mentioned some people have caffeine sensitivity, whereby they take caffeine and they get nervous and jittery, But it depends on it depends on the dose that they take. Some people can take MSGs, sulfites in alcohol. They have a headache, flushing. Some people are histamine intolerant. They cannot break down histamine in their foods, and their symptoms mimic allergies, but there's no IG involvement. So that's the reason why it's very important when you have these symptoms to see your doctor, so that they can test. There are various tests that they can do, right? So, do you imagine if you have histamine intolerance? If you found out that you have histamine intolerance, then that is like really good, because now you can avoid foods that with histamine, So that's why it's really good to, when you have symptoms, try to investigate, become a food detective, become your own detective, just don't say, this is my life now. Yeah. Okay.
Yes.
Good. Okay, I had some trivia questions. Is lactose intolerance an allergy?
No, it's not an allergy.
Good. What kind of reaction is peanut anaphylaxis?
Type 1.
That's good. Yes, immune.
Is that what you're asking?
Yes, good,
Okay.
good. Which immune reaction is delayed and T cell mediated?
That becomes your type 4.
Good. I don't know why I'm asking you these questions. You know them, but this is good for people who are watching. Just kind of like summarize.
Right. Yeah, for the audience.
Yes, and histamine intolerance involves IgE antibody.
Yes.
Histamine intolerance. Intolerance.
Oh, intolerance.
Yeah.
No, that's not the G.
Good.
Yes, sir.
Yeah.
Intolerant, yeah.
Yeah. So the thing is, if you're having these kind of symptoms, it's very good to have a food and symptom journal. You can use elimination diet. We have discussed that before in this podcast. You can support your digestive system, probiotics and things like that. But remember, even the non-immune mediated issues can still trigger inflammation downstream, So like gut dysbiosis can cause immune activation later. So remember, the immune mediated is like the faulty alarm system, and the non-immune is the blocked pipe. Okay?
Yes.
Okay, we are almost there. I promise you, we are almost there. Good. Now, I wish Monica was here. They could have given us let's breathe in and out. Take a deep breath. I'm not going to do color meditation because I don't know if you know your colors. Like my husband. No. My husband doesn't know his colors, so I'm not going to do color meditation. So, okay. Now, we are going to focus on the immune-mediated reactions, which are two. I'm going to focus on two mainly. IgG versus IgE. Okay? And I want us to kind of determine what is the difference. So, IgE, of course, it's allergic, it's immediate, right? IgG is mainly sensitive. So IgE is fast, the onset is fast. IgG is a little bit delayed, right?
Yes.
IgG is dose dependent, and IgE is small amounts. For example, if you're allergic to eggs, right, your symptoms are going to be immediate, right?
Right.
But for IgG, probably they might not be immediate. They might come maybe 1 hour, maybe 2 hours later, maybe a day later, right?
Yeah.
And they're dose dependent. So if you eat a lot of eggs, you have more reaction, for the IgG. And that is why for IgG, elimination diet really works well, because what happens, IgG, and you remember when we were saying the elimination diet takes 3 weeks. Why they say 3 weeks is because the half-life of IgG is 21 days. So if you eliminate that food for 21 days, right, you reduce the amount of IgG. So the next time you eat an egg, the reaction is not that bad, right?
Okay.
But for IgE, right, the antibodies duration can be long-term, can be lifelong, right? So that's why if you have an IgE reaction, you really need to avoid those foods, right? But as I said, IgG, the antibody durations, they can decrease with months after elimination diet, you see? So actually, just by knowing, how you react to a food, you can know if this is, if you have an Ig mediated or IgG mediated. You look at how fast it acts, the onset, the duration, the quantity of food, because IgG is dose dependent. IgE, you can just take a little bit. Some people smell peanuts and they break out into hives. That is an IgE. And for IgE, you will definitely know that you're having a reaction. IgG, you don't know. I'm having a headache. I don't know what's happening,
Could be what, yeah.
Yeah, so those are the main difference, and they do have different testings for them. Like for IgE, they do have skin prick test, right? They also do have a blood test, serum test.
Yes.
But the good thing about IgE, the testing, you can use the same lab, and the testing is more reproducible. IgG, it depends, it depends on the lab. So you have to probably go to a lab that your immunologist uses, So that's the difference between IgE and IgG food reaction. Okay, good. Okay, okie dokie. Do you have anything to add so far?
No.
We have discussed a lot of things
Very,
today.
very helpful table there.
Yes, that was
I love that table.
yeah. And a lot of people have been discussing about wheat, right? Wheat, everybody thinks that they have celiac disease, and probably not. So there's a difference between celiac disease, wheat allergy, and something else called non-celiac gluten sensitivity, right? Wheat allergy, when you think about that, that is an IgE mediated. That means you eat a little bit of wheat and you have swelling, hives, and anaphylaxis, right? And of course, the test for that is skin prick and IgE test. What do you think celiac disease is?
IgG.
Actually, no. Celiac is autoimmune. It's an autoimmune.
Yes, and you mentioned that.
Yeah, it's an autoimmune.
Yes,
it's like lupus, it's like your body.
Yes.
And I think you remember this. So what it does, it's of course it's triggered by the presence of wheat, right? But it has these antibodies, that you remember the anti-TTG antibodies, right? They actually go and attack the villi of the small intestine. So what are villi? So on the small intestine, that is where a lot of your food is absorbed. And to increase the surface area, the small intestine has like finger-like projections, right? That helps absorb nutrients. So what happens in this celiac disease, that those antibodies go and actually attack these villi. And so when you look at the biopsy of this patient have, the villi are not really projecting well. They're very unhealthy and they're kind of like this, So celiac disease is an autoimmune disease. You normally see it, it's genetic. You see a lot of it with people from the Northern European ancestry. They normally do have this celiac disease.
Yeah.
And then there's the non-celiac gluten sensitivity. The mechanism is still unclear, but probably it's immune. And for this, people have like brain fog, bloating, fatigue, but we don't have a way to really diagnose this. Okay, but we know celiac, it's autoimmune. The antibodies actually attack the villi. Wheat allergy is Ig mediated. You actually have swelling, hives, and anaphylaxis. And non-celiac gluten sensitivity, it's not clear the mechanisms, and you do have these symptoms, like brain fog, bloating, and fatigue. So if you notice that when you're doing like your journaling, your food journaling, and you notice this, go get tested so that you can know what it is, Good. Okay. Okie dokie. That was a mouthful.
That has been a mouthful 2 months.
Yeah. Okay, let me give you a scenario. Maria gets migraines 24 hours after eating pizza. No hives, no GI stress. What do you think they need to do? Every time they eat pizza, they get this. They just get migraines.
The most natural thing is to eliminate that food for 21 days.
Yeah. Yeah, and see, right? Become your own detective. Be curious of your body. Okay.
Yeah.
Which test identifies life-threatening allergic reaction?
Oh, that's your IgE.
Yeah, you need to do IgE testing. True or false, IgG tests are universally accepted as diagnostic by all medical boards.
False.
False, yeah, because I said, it depends on the lab that you
Yeah.
go to. Which condition causes your immune system to attack your intestinal lining?
That's your celiac disease.
Celiac disease, good. Which food reaction is diagnosed after ruling out celiac and allergy, but symptoms improve with gluten removal?
Yeah, that's gluten.
That is a
disease.
non-celiac gluten
Non-celiac gluten.
gluten sensitivity. Yes. Okay.
Non-celiac.
Good. So if Donald had an allergic reaction after drinking milk, would you give them albuterol, give them some Benadryl, give them some stinging nettle tea, or give them an EpiPen?
I want to say it depends on the level of the allergy.
It's an allergy reaction.
EpiPen.
They are having hives.
EpiPen.
Exactly.
Okay, EpiPen
Yes,
is it.
yes. Okay. So this is this is my final takeaway, but I want you to give me your final takeaway. we covered a lot. We covered
It
a
has
lot.
been a month since the last time.
Yeah.
And again, this is not an easy topic by any stretch of imagination, but you definitely made it very, very easy and tolerable. So thank you for that.
Uh-huh.
But we just learned about the immune system itself and how complex it can be. I mean, we know that it's our internal defense. However, it goes a long ways than just defense. It really protects us. It remembers what it sees, and it obviously is very adaptable, all right, to adjust itself. But even more so, the relationship between that and even your brain itself is just, and the scary thing is there's still a whole lot more that has to be discovered in this field. So this is very mind awakening.
Good. I'm glad. I'm so glad that you answer my call every time for these discussions. I'm really, really grateful. It's fun going through this with other people. Okay, so my takeaway, symptoms are signals. Okay, when you have bloatiness, headaches, those are signals. They're not nuisance. Okay, don't ignore them. It's your body talking to you. Also, food reactions aren't just about allergies. They are windows into your immune regulations, gut integrity and overall inflammation. Chronic inflammation is not the fire. It is the smoke from hidden sparks, poor sleep, stress, toxins, food triggers, or unresolved trauma. And you are not a separate part, right? You are a holistic part. So think about your gut, your brain, your immune and mind, all deeply interwoven. That is my final takeaway.
Thank you.
Good.
Thank you so much.
Thank you so much. Until next time, huh? Until next time. He said so. Okay, bye-bye. Thanks. In this episode of Immunologic, we explored the elegant complexity of the immune system, both its rapid-fire innate defense and the precision memory of adaptive immunity. We walked through immune-mediated versus non-immune-mediated reactions, food reactions from IgE to IgG, and uncovered the often overlooked drivers of chronic symptoms, leaky gut, leaky brain, and systemic inflammation. Through the lens of functional medicine, we reframed these concepts not as disconnected diagnoses, but as clues in the web of interconnected systems, influenced by your history, environment, habits, relationships, and resilience. Your immune system is not broken. It is often overwhelmed, misdirected, or inflamed because of unresolved root causes. Our call to action. Take time this week to reflect. What is one mediator in your life, like sugar, stress, poor sleep, that you can shift? What's one signal your body has been giving you that you have ignored? Start small. Functional medicine reminds us lasting transformation starts with awareness, curiosity, and commitment. Until next time, stay curious, stay connected, and remember, healing is not about perfection. It is about realignment with your body's wisdom.